This is Professor Michael Chapman. I'm one of the most experienced IVF doctors in Australia. I believe that an important part that I can contribute is to educate patients in relation to fertility, infertility, and all that involves. These series of podcasts help to educate you. I hope they are helpful to you. If you wish to know more, however, I'm more than happy to have you contact me via email, which is profmchapman@gmail.com, or make an appointment to see me on 9138 4222.
Question that was submitted earlier, Prof. Could you talk about the different types of male infertility?
Okay, I think in a former program we talked about male infertility, but let's just have a quick run through again, because obviously it's not uncommon. We're now seeing something like 40% of infertility is now associated with male factor problems. The most severe male factor problem is obviously no sperm at all in the ejaculate. So when a man produces a sample, we find no sperm. That's unlikely to be a sample error, although I certainly have had men say to me, oh, well, it's low because I only got a couple of drops of my ejaculate, I missed the pot. But even just a couple of drops, we can see whether there are sperm there. There should be sperm there. So no sperm. Now, no sperm accounts for probably about 5% of male infertility. So it's not the only poor quality sperm that we see. We see low numbers, we see poor motility, we see poor morphology, we see something called DNA fragmentation. But the man with no sperm obviously is unlikely ever to produce a baby. The two different causes of no sperm in the ejaculate is one, obviously there's a blockage. If there's a blockage, the testicle production line may be working, but the sperm can't get out. So there's a condition called congenital absence of the vas deferens, which is associated with the lung disease, cystic fibrosis. So nature has not allowed the vas deferens to form. The testes is actually producing sperm, but it can't get out. Other things that can cause blockage, or not absence, but blockage of the duct is sexually transmitted diseases. Gonorrhea is the most common. Chlamydia probably causes scar tissue and then blockage, and then it can't get out. Obviously, vasectomy will also produce azoospermia, it's supposed to, but I've certainly had a couple of men who didn't quite realise that was the outcome when they came with their second partner. In all of those situations where there's blockage or absence of a vas or a vasectomy, we can get pregnancies at the same rate as any other pregnancy where there's normal sperm, because we can get sperm directly from the testicle. There are two approaches to that. One is to just stick a needle into the testicle and aspirate the tubules that are in the testis where the production line is working. Scientists then teases out a few sperm, and we only need one sperm per every egg to produce an embryo. If it's more difficult, we occasionally need to actually open up the testicle, formal procedure under a general anaesthetic, and with the use of a microscope, we go looking for nests of sperm to harvest to help get a baby. The other and the more common reason for no sperm is, in fact, that the production line has failed.
And don't forget that you can access all the previous episodes by going to our website www.theivfjourney.com and select IVF Journey Podcast from the navigation menu.